Welcome to another episode of the Nurses Business Solutions. It's me, Mr. K, and I'm not alone. I'm with Sister Maureen, the beautiful Sister Maureen.
Only. Yes, we are on it again, guys, as we continue to uplift, to upface, to upskill, to educate, guys, in the healthcare space. We are not talking only about nurses. We are talking about each and everyone in the healthcare space who wants to open their own businesses. This is the right platform, guys. This is your favorite show. We are back again. So today we are talking differently. I've got my homeboy.
Yeah.
So nice. Guys, so those who don't know me,
Boy.
my name is Maureen. I'm the CEO of Exclusive Medical Agency. I am the founder and the director of NBS Business Solutions. And most importantly, I am a nurse. A profession.
A boss nurse, not just a nurse.
Yeah. So we continue today to Mulovedu Mulodzi. Wow, Mulovedu. Guys, I told you we're gonna Mulovedu. So today we go hack and check.
No. The last time I was in Liverpool. It's not easy.
So we've got Austin today, Makurupeji, all the way from Limpopo, born and bred in Limpopo, but obviously at the moment he is now here in Gauteng. Guys, I'll be doing him no justice if he continue. Like a profile. He is here to actually tell us who is Austin. So, okay, please tell us about yourself.
My name is Austin Makurupechi. I'm from Bulovedu. As Sister Maureen has said, Musimana kwa Bulovedu. The only thing I can do is to speak Kilovedu on TV, but today we're gonna try. Otherwise, I am a professional nurse by profession, and I reside in Gauteng. Let me go down. Bulovedu ha Guranda. Gama Kurubeji. And one thing I know is that Bama Kurubeji Bulovedu Bazebea, and that's the reason why I'm here on this platform. And thanks to Sister Maureen and thanks to Sister Mr. K for bringing me on this platform, and I'm very grateful for that.
Wonderful, wonderful. Okay. We are so happy to have you.
Yeah, we are. Hey, today it's my day. Hey,
and it's not the first time, by the way, on the NBS cameras.
Yeah,
it's like the third time. The summit.
Oh, yes, he was at the summit.
The grace opening of the clinic, and now the podcast.
Yeah, here in the quarter of NBS.
Definitely.
Yeah, guys. Obviously, we continue talking about empowering nurses. You know, I'm so happy today because we've got Austin, someone who is coming from deep down in Bulovedu, in Limpopo. You know, I mean, I don't think only any of the services there around your area. And you must tell me, why are you not opening a clinic there? Because you have to.
That is very true, Sister Maureen.
You are a nurse, right?
Yes, I'm a proud professional nurse with 13 years of experience.
Wow. 13 years.
Yeah, I became a nurse when I was very young, so yeah, that's why I'm saying I'm a proud professional nurse.
Okay, and you are now employed by private hospital or government?
I'm employed by a private hospital, one of the private hospitals in Gauteng. Okay. And also I've got my own business. As Sister Maureen says, she's the CEO of multi businesses. Currently a CEO of my company, which we are hoping to expand, just like her, as she's my role model. Yeah. But otherwise, I'm a professional nurse.
Beautiful.
She's my role model indeed.
I like that nurses are, becoming business people, entrepreneurs, but they're still saying, I'm a proud nurse. What is that? Where does that stem from?
Okay, can I take that? It's because our professional identity has given birth to who we are at the moment.
Oh.
So he mentioned he's a nurse.
Yeah.
And then he also a CEO of his own company, which is going to tell us more about it. Where is that coming from? From being a nurse.
So
that's why that has to be there.
Wow.
That's why I am called Sister Maureen.
Yeah.
I'll take that with me everywhere.
Okay.
Amen.
Makes sense. Beautiful.
Yeah. I hope I've answered him.
Thank you so much. That was brilliant.
Yeah, okay. So you are still employed, working on the floor. How is it to still be working and doing a business at the same time?
Sister Maureen, it's quite hectic because, whenever you're running your own business and then there's work at the same time, it gives you that challenge. But then again, it it gives you that strategy of making sure that you're able to to magnify your own future.
Yeah.
If I put it that way, I'm trying to say that whenever you're a business owner and you're working for somebody, it qualifies you to say, even if you're doing somebody else's job, at the end of the day, you are able to do yours in a different way. So basically, you are able to multitask, if I put it that way. And what do they say? Multitasking people, they are very intelligent people. So, Yona Vele, it gives you that.
Yeah. You know, I always encourage people to direct their skills to the right platforms. I don't know if you understand.
Direct your skills to the right platforms.
Yes.
Untable
As
that.
nurses, we do a lot of overtimes. We work ourselves night and day. We overwork ourselves because we want to augment our salaries. So I always say to people, do that, but then invest in your own business like he's doing.
Yes.
In his off days, he's
Yeah.
investing in his own business. You understand? He's
True.
directing
Yes.
his skills, his time, he's directing
Okay.
it to the right, because he's at the same time building his own his own
Definitely. Legacy.
Legacy.
Yes, that's what I want to say.
Mm.
Okay, so what tell us about your company. Tell us
Okay.
about an H2O. I think the name of the company is H2O. Yeah, as stays on this nice.
H2O Clinic, your health, our
Yeah.
priority.
Tell us more about their business.
Okay. I want to say something first before I start telling about the business. I remember the first day when I inboxed Sister Maureen, I was like, I had a vision that one day I want to sit with Sister Maureen and explain where this H2O comes from. And I remember once when I inboxed you, I was like, you were asking, you posted a video about how did you start your business. I thought about it to myself, and I was like, actually, I started my business with 60 rands where I bought.
You serious?
Yes, I even thought I had a vision that day when I inboxed her. I was like, no, you know what? She asked everybody, "Hore, how did you start? How much did you use to start your business?" I was like, no, I had 60 rands. And that was it. I didn't have anything because I remember the 60 rands. My cousin was like, no,
16 or 60?
60.
Okay, yeah.
The reason why I'm saying 60 is because my cousin was like, do you want a logo? I am a graphic designer, but I can create a logo for you.
Okay.
And then I was like, since you're family, buy me a bottle of something. And that something was 60 rand. I was like, okay. And he created this logo for me, a cousin of mine from Pretoria. So that's why I wanted to start there. But otherwise, my company is the H2O Clinic.
Okay.
The reason for H2O Clinic is because it is based on my spirituality. I'm a water spirit. I'm a Scorpio. I believe in water. I believe that as a nurse, everything is surrounded by water. Everything you use in the hospital is water. So I was like, you know what? Let me branch out from the hospital setting and say, this is something else. Health 1, 2, 3, 4, 5. I was like, no, the H2O water speaks to me. That's why I got the whole dream about the H2O. But otherwise, as a water spirit, I resemble water. I live water. I breathe water. Everything I do is all about water. So that's where I got the H2O Clinic. And everything after that expanded from that the name of the clinic and that dream. So with H2O, I first encountered the experience of working for a certain establishment in Gauteng where things were not magnified and I couldn't even expand my skills, if I put it that way. Okay. So I was like, no, you know what? The day I start my own practice, I'm going to expand skills and broaden the spectrum of everything that was being done at that company.
So basically, this is the journey that you had to go through from a nurse to then transition into your business.
Thank you. Yes. So that's why I'm saying that after that, it's where I took everything and I ran with it. And thanks to that company that I believe they're the one who put fuel on my dream.
Wow.
Mm.
So it was a private company.
It was a private company
Never
that
been to government?
I've worked in government. I've worked in government for almost 7 years.
Okay.
And then I worked in private for 5 years. And then now I'm in another private for 3-4 years now.
All right.
Mm.
Okay.
Beautiful, beautiful.
Okay, all right. So basically your clinic or your medical center is centered in the aesthetic department, right?
Yes. What I want to say is that with H2O Clinic, remember, Sister Maureen, as I've said in the beginning, it's all about water. So my branch to aesthetics was that IV drips was one of my concepts that I wanted to do. But then again, at that previous business, they couldn't allow it.
Okay.
So that's why I was like, okay, I'm going to incorporate two PHC and IV bar.
Okay.
So that's why I got up with the whole package of having an H2O clinic, which stands for medicine and which also stands for IV bars. So basically, all of them, they incorporate each other.
Oh, nice. So your clinic is actually governed by Section 22A.
Yes.
So meaning you can do family planning, you can do immunization. So there is multiple services that you can actually, not that you are giving only IV.
IVs.
Okay, that's nice. That's
Beautiful.
nice to be.
Yeah.
Because I see here the services are actually listed on his desk. Oh, what is a banner, right? Yeah, family planning, pap smear. Oh, you do pap smear as well.
Yes.
Breast examination, pregnancy urine test, baby immunization, antenatal consult, HIV counseling and testing, STI management, PEP, BP and glucose, cholesterol check, mini medical, BP, like the normal medical checks, AP screening, admin of injections, and adult immunization, treatment of wounds, minor alignment consult, house calls. You also go to people's homes to provide the services, which is very beautiful.
It sounds like
So
a full-fledged
It's a full
clinic.
package, yeah. No, when you are governed by Section 32 as of the Department of Health, yeah, it comes with comprehensive services that you can actually add in your practice, you know. And some of the services that I've mentioned here, you just being an RN, you can practice those
Yes.
services.
Yes.
Wow,
Just
just
being-
being an RT.
Just being an RM.
Registered nurse.
Registered nurse, you are
Yeah.
they fall under our scope of practice
But-
from South African Nursing Council.
But I'm a little bit, I'm a little bit shaken by everything that you have just read there, right? Versus the idea that, he's employed. That's his business.
Yeah.
You're employed. Please paint a picture for me to make me understand how does that work.
And how is it possible? Because that was going to be my question. He's working, he's fully employed, and he's expected to provide certain hours per week.
Yes.
And then at the same time, he is having his own company that he needs to make sure that. How do you balance the two?
Okay, so this is how we do it. And
This is how we do it.
you know why I'm saying this is how we do it is because the way Sister Maureen as is balance as no, it's just that somebody once a few people always ask me, how do you do this? How do you guys do it? I see Sister Maureen is doing it. I see you are doing it, and I'm like, no, you know what? As long as remember, at the end of the day, an individual is barking in English, okay, and no man is an island.
Yes,
So
yes, yes,
basically,
yes.
if you are the forefront of a business, there's always a team which will always support you. If you've got a support, then everything works out. If you've got somebody who plans your diary, if you've got somebody who organizes, if you've got people that you know, they are your backup. Everything is possible because I mean, with me, I've got a PA. If I call her a PA, her name is Tembi. So she organizes, she plans everything.
Thank you so much for
Hi,
making this
Tembi.
alive.
So she plans my diary and then I give her my off duties and then she plans my diary according to that. So when she books clients, she books according to the days that I'm open. Most of the time, I'm not even free, if I put it that way, because when I'm off at the hospital, I'm at the clinic. If I'm not able to go to the clinic, I'm doing housework. I mean, house calls. If I'm doing house calls, there's another lady who assists me.
Wow.
The one I work with. So she comes part-time whenever she's free. So that's what Tembi does whenever we sit down and we organize our monthly schedule. So it's doable, basically, if I put it that way. As long as it's just that it disturbs the other parts of life where the social, there's everything. But then again, when you're building a legacy, socialization is minimum. You focus.
You focus and actually you prioritize.
Yes.
So it's doable. That's what you say. It's doable.
As long as you've got a team.
I don't think there will be someone there. there will be. I don't think there will be someone who will say, "I'm working. I don't have time to do this and all of that." You understand?
But how do you then differentiate the idea of wearing the nurse scrub versus now going to your own clinic? The caps that you put on. How do you switch from being an employee to now going to being a leader, a boss? Like,
Can I answer that?
Yes.
I think, Sister Maureen, when you have what Sister Maureen said, I'm trying to put it in a proper way. Sister Maureen said, even if you're a CEO, at the end of the day, you're a nurse. If you are born to eat pap, even if you get to China, okay, at the end of the day, you will crave pap. That is who you are. That is who you were raised to be.
Okay.
So basically what I'm trying to say is that the foundation of who you are is what builds you. Even if they say, wake up 30 days, if Sister Maureen, for instance, God forbid, she goes into coma, when she wakes up and you're like, what is the normal BP? She will answer it. Despite whatever she was in or whatever it is. But the moment she wakes up, because that has been engraved inside her that she's a nurse.
Wow.
That's why I always fail to understand whenever people say, nursing actually is not a calling, but it's no, you are lying. Nursing is a calling. Even if I wake up a pastor and say, what is the first verse of 1, 2, 3, 4, 5? The pastor will tell me. Because
On it,
that person has been called to do that job.
Wow.
Unlike other people where you're like, no, give me this. And you're like, okay. Then you're like, okay,
Yeah.
I see this one. So this
Sister Maureen, when you're telling me, Owuti, you go to your nurse work,
Yeah.
you leave your nurse work,
Yeah.
then you go be a boss. And in that nurse job of yours, you don't have that thing with, I'm a boss, me, nah.
Well, you tell me. I don't even know I'm a boss. I'm hearing it from you. I mean,
tricky.
CEO is a title. I am a nurse. I'm very practical and I'm a hard worker.
Thank you.
And they
So-
treat you the same at your workplace?
There are a lot of people whom I work with to 10 patients in the hospital. Let me tell you. Last week, I went to one of the hospitals that we are partnered with. I'm going to mention here it's Woodspruit.
Okay.
And I got into the theater and there was a crisis. I am a CEO. I came there to clinically support my nurses and talk, just you follow up, contact meetings with your clients. When I get there, in theater, there was a problem. There were short staffs and there was an emergency. It's theater. Any cases, anything's expected. You know what I did? I asked them to give me a scraps. I went to work.
Thank you. That is what I'm talking about. That is what I'm talking about.
Skills. I'm running an agency. At the same time, I am actually putting my agency in a good space with the client. Tell me how they will want to terminate my
Wow.
contract. When I got there and I changed my name tag immediately. If you go to my TikTok, you will see. I removed my CEO name tag and I've put a name tag that is written registered nurse.
Wow.
Yes, and then I went
brilliant.
into the theater. I said, okay, give me, what is the case? What are we doing? Are we in the recovery? What can I help? Let me cover patient. Let me push the patient to the ward. Yes.
Yes.
I was the first, everyone was shocked. They came actually to witness that.
Yes.
I said, no, guys, I am a nurse.
At the end of the day.
I'm running a company. Just off yesterday, I remember my drivers were all, remember we also doing transportation services, and my drivers were occupied because we had a lot of requests. And I had just knocked off. It was 4 o'clock.
Yeah.
And I saw on the group that there was a need for collection somewhere. And I know there's one driver in Pretoria that is collecting, and there's another one in Sebokeng. You understand? And I need now, we need another one to go to Landmed. You know what I did? I got into the car and
You lie.
yes.
Yes.
And when I got there, I said, I am here to collect. Can I park on and then they gave me a parking. I went, I said, my name is Maureen. I am not a CEO. My name is Maureen from Johannesburg Surgical Hospital. I'm here to collect this issue. Yes. That's how we do it. It's not, I don't have an office. That's the thing.
Yeah.
I don't have an office.
Yes.
I'm because I used to have an office, but it was a waste of money to have a bigger space that I have an office to own because I'm practical.
God.
As a nurse, we are taught to make sure that we are our nursing is aligned or is structured under 5 processes of nursing, which is assessment, planning,
Implementation,
evaluation,
evaluation.
report, and record.
Yes.
Those are the 5 structures of nursing.
Five
Of
structures of
nursing.
nursing,
Hey, whoa.
5 processes of nursing. That as a complete nurse,
You
you need to know, and you need to have went through from the first to the last on a daily basis.
But do you realize those structures, if they are instilled in nurses, automatically that tells you nurses are being taught how to run business.
Thank you.
Those structures are how to
Thank you.
innate and
Yes.
to run.
Yes. So I want to agree with Mr. Austin when he said it's doable, because when he is on duty, he is actually practicing the services that he would practice in his own space.
Yes.
You understand?
So
my-
automatically, if you are a nurse, it's like you're running a business.
Yes. So yeah, it's a nice conversation today, hey? And we're gonna get some IVs today. So today you are receiving some IVs. I've already chose mine today. I want a jet fuel. He will explain to me what is jet fuel, because I'm not in the aesthetic space. However, I think I need a little. He did touch base on it. I need a little bit of energy, nyana, ne? Yeah. And then I've chose one for my partner, and he's not going to refuse. I'm giving him this one. Yeah.
They want me to do libido. I'm not doing that, guys. I'm not doing. I don't need the libido for about it.
Let to you now. What has been a challenge? Give us one that one challenge. Okay, obviously you started your business at 60 rand. That is already a financial challenge. That,
Already.
yeah, but then I love the idea of that. With that 6 rand,
Mm.
he chose to use it wisely. Something that would actually still make his business known,
Exactly.
which is what?
Exactly.
Billboard.
Mm.
If people knows about you, even if you don't have money,
Yeah.
and they ask for your services to say, we want a drip, we saw you, you are giving drips, can you give it? You are even able to ask money from me to say,
Exactly.
that's why I
Easy.
tell people, guys, prioritize marketing.
A lot.
Talk about your business, talk about your brand, irritate people, guys. Let us know what you are doing. Do not allow a day pass without talking about your business. That is, invest in marketing. In business,
Definitely.
we invest in marketing, because
Definitely.
the broader your name goes out there, the better for your businesses.
Especially in word of mouth.
Yeah.
It works a lot.
Yes, word of mouth. So what has been a challenge, apart from financial challenge, what has been your challenge in that you are facing, or that you faced in your business?
During the business or in the beginning?
Let's talk about in the beginning.
In the
because you know
beginning.
why beginning? A lot of people are very scared to start.
That's
I want us to talk about that foundational phase.
Yes.
Can we touch base on that?
You know, one thing I always said is that I think I saw it on one of your videos that you once mentioned not people, but nurses are scared. That is the biggest challenge I think nurses have.
Yeah, feel
The fear of the unknown.
Yeah.
But then again, if you have resigned once, why are you scared? Why are you scared? We were all scared of resigning, but we resigned and then we got another job. So if you have passed that stage of fear, it means that you are limitless. You're not limitless, but you are able to continue. Otherwise, in the beginning, with my challenge, I think it was the challenge of I didn't have space. It's so complicated. Whenever I remember in the beginning, you draw up a business plan. You do your feasibility study, you do your marketing strategies and everything. And then this is where I want my clinic. I want it in deep down Tembisa. And then you have to look for a place where the building needs to be. That is the biggest challenge that I had in the beginning. But otherwise, the second one was just smaller kind of things, even though it was not money, because I was working, knowing very well that I would fund my business with what I had. So the biggest thing was getting space, because I think it took me 2 years to get a space, because I went to all the buildings in Sandton, all the buildings in Rosebank.
What was the biggest hurdle in getting a space, though?
Most, I think, it's one thing that I sat down. I used to attend business studies at downtown the road in Henley Business School. They used to say that even if your business plan is perfect, it might be a challenge if you haven't researched about the area that you are in, because there's a lot of aesthetic clinics in Centon.
We're gonna talk about that.
So when you get into a
A
building,
lot of aesthetics clinic is another thing, but let's talk about the legality part of it.
true,
But then we're gonna come to that.
to that one,
That the finding an area
an area where
would be accommodative for your business
Yes.
was a challenge.
that was the biggest challenge ever, because when you knock into a door, they're like, no, there's somebody who's doing that. I'm like, okay, let me go to another mall. There's somebody who's doing the same thing. And then you go to a medical center, they'll be like, already we've got 5 doctors in the area. I'm like, okay.
But that does not stop you from
It never did. Never did. That's why I resorted to doing house calls. I kept on pushing myself, like, you know what? One day something will come up. If this is closed, it means that was not good for me. It was not going to be a good place to place my business. So I kept on doing house calls. I kept on doing going house to house, doing even PAC house calls. And then 2 years later, that's where I got the space where you visited me. Yes. So
Wow. And it's a
getting a
beautiful
space
space.
in.
Is
It is in Sonten, and
Wow.
yeah, it's a very classy
Yeah.
place.
Set up and
It's
yeah.
and let alone classy, but the therapy, it's very therapeutic.
Wow.
When you get in there, you relax. There's that.
Who designed it for you?
Um,
The
you won't even say it's owned by a nurse.
Mm.
Yeah, that's how classy it is.
You designed it yourself?
It was me and this friend of mine called Dr. Chen.
Okay.
She's the one, we came up with the whole idea, concept of doing interior design,
Yeah.
because she was like, no, I don't know anything about South Africa. She just landed. So I was like, no, don't worry. Let's go through working designers and everything. She was like, no, we don't have the money. Let's just do it ourselves. I'm very good when it comes to interior decorating and all of
Sister Mure-
aesthetics.
the Goodness and Sister Grace, who designed them?
Goodness is actually we NBS assisted.
Okay, beautiful.
And then Grace, let me tell you, she did it herself.
Beautiful, beautiful.
Yeah, Grace, she's also someone who
Yeah.
with skills.
So if somebody wants to join NBS right now and open their own clinic, we have people who have experience as we
Yeah. So and that is very important. You please note that in a medical setup, we don't just decorate how we want to.
True.
There are regulations. We are governed by the license.
Oh.
So you will have a basin that has a soap to wash your hand and all of that completes compliant.
Yeah.
So it's very, very important to have that in mind when you design. So
Yeah.
you still need NBS to be part of your.
Just like you were ticking when we were opening the Goodness, you were
Yes, yes.
ticking.
You see me,
Yeah.
did you see? I was
Yeah.
going through the travel list
Yes.
from Department of Health. So
Okay.
that is how they want their structure to be.
Beautiful.
To be able to be to actually govern your
Yeah.
clinic. You understand?
So automatically, when you join NBS, you have people with experiences to make sure that your structure is perfect. And don't forget, it's very important for you to subscribe. Subscribe. We've got great competitions we're going to be talking about. We're going to Limpopo, right?
Yeah.
Yeah.
Limpopo people, yeah.
Yes, so mina pleasure jamanyana.
Exactly.
Yeah, am I ready? Ready Ramasanda
Babina masanda wana Limpopo.
So
Yeah.
the one not even one of the questions that comes to me, or a concern that comes to me from my members, is the competition that we have. We've got doctors are
Yes.
employed and they are resorting to
Aesthetics.
aesthetics.
Yes.
We've got nurses who are also allowed to do aesthetics. Now we've got the salons,
Yes.
who've got unclinical people believes they can do it. How do you see that going, Austin, in your profession? Where do you see that going actually?
It's a big challenge though. It's not even a challenge. It's a matter of working intellect, if I put it that way. Remember, Sister Maureen, there's a big difference between a nurse and a doctor.
Yeah.
So the third person that you put in to do IV drips who's not medically trained, it's going to be a problem. I mean, you did biology in nursing for 2 to 3 years, and then somebody does it in 2 days. So what are we saying to the people? What are we saying?
Huge
This is
risk.
someone who's
It's-
doing medical procedure.
Imagine, and then
they trying to look for a vein.
thank you. So that's why I kept on saying, you know what? At the end of the day, we tend to be gullible when it comes to certain businesses because we know that this is not right, but we keep on doing. And let me give you for instance, when you study aesthetics, there's a diploma for the doctors. There's a diploma for the nurses in aesthetics. So if somebody's gonna come and say I'm putting up IV drips and then they've never done biology and they've never went and sat down in a proper working
Set up where
permitted
about
class
anatomy and physiology.
where they learn about anatomy and physiology, we question that. Or, okay, you are saying that you've got a business. What is a business about? Already we know your business, what is it all
Let me
about?
support
You get what I'm
in
saying?
the same space with. I am 100% against that. But I want you now to tell the viewers. I want you to tell the viewers how to react when they get in a space where they want to be given a drip by people who are not skilled.
How do you identify somebody that's not skilled in the first place?
Thank you,
Yeah.
Kay.
Yeah, that's a good one. Because that's the first thing. People go there sometimes without knowledge. They don't know, or this person is actually not skilled, or is not educated in this space. You understand? So I think the first thing you will have to be brave, and that is what I want Austin to tell people how to behave when they get there.
Yeah.
Austin, please tell our viewers at home.
Ladies and gentlemen,
Yeah.
this is my advice. So, one thing I want you guys to do, each and every medically trained professional
Yeah,
has got an SPSA number,
yeah.
a sunk number. Somebody who doesn't have, that's a criminal. That's a very, very big criminal. Because with us, Sister Maureen, if your sunk license has expired, you cannot practice. You will be taken to jail. So imagine case somebody who didn't even register with the South African Nursing Council or the Pharmacy Council or even the HPSA Council.
Yeah.
That is legal. That is illegal.
And you allow them to poke you and put
And
it-
worst case scenario is people that we see around us.
100%
It's very, very wrong. People need to understand that whenever you sit on a couch, yes, it might be cautious, it might be beautiful and everything, aesthetically beautiful and very, very stunning. Ask that person who's putting up the drip, where is your sunk card? Registration card. Where is your HPSA card? That is the only thing.
Okay.
Because at the end of the day, I can even show you how to make acha, and then everybody can make acha.
Yeah.
But somebody who was trained as a chef can make proper acha. Unfortunately, they don't have the tickets or the card.
That is true.
But with us, this is human life. And the reason why we're saying it's human life is because literally, if your license has expired, we tend to be removed from the system because you cannot work with human beings.
You are
Yeah.
So
certified, even though you are educated, you've got qualifications.
thank you. Even
You need to be governed by our governing body, which is South
That is
African.
so
South African Nursing Council. So that's why I'm saying, or every time you sit down and then you ask somebody, you're like, I'm coming to get a drip. First thing first, ask, did you go to school for this? And then where's your sunk or your HPSA number or card? And they need to produce that because we got a lot of people who are opening salons, not even salons civile. They are the worst places. They open even at spas. They're hiring people who are non-medical, if I put it that way, or
Even in the
non-clinical.
pharmacy, some of the pharmacists I've seen
Yes,
pharmacists
Mm.
in Joburg,
They-
they just grab anyone.
just like
Either
that.
the professionals in the lower category, like my care worker,
Yeah.
which is
What is the regulation implications behind that if they find you doing that?
he just mentioned is a criminal offense.
It's a criminal offense.
You
Yes.
to be prosecuted.
Yeah.
Currently, Kay, I'm just gonna not talk deep about it, but two of people that I've got mobile IV drips,
Yeah.
they messed up. So it's sort of like that thing that somebody wants to do IV drips and they know they're not in the right profession, and they started it and they went to these IV, these I don't want to say background colleges where somebody teaches them in the kitchen how to put up an IV drip. But then again, so they've got 2 clients. These 2 people, they've opened an IV bar and an IV in a clinic.
Yeah.
They've got 2 patients who've got sepsis. Because why? None, that was not professional. They were not trained at a well-established university. These people are not even registered with any council that will back them up.
Yeah.
So they messed up people's hands. And then, unfortunately, for them, they messed up people who are non-South African. So I don't want to say they will get away with it, but that was wrong. It's human. It's human beings.
That is so wrong.
For me to call me and say, what do I do in this situation? There's nothing I'm going to say. Go to the nursing council and check. What do you need to do? If you don't have, if you're not registered, take yourself to jail, unfortunately. So that's why I'm saying, or most people open these things in a spa. They open them in saloons without any registration from a proper established university or college.
So, also to add on Austin's comment now is that aesthetic is a cosmetic-related procedures.
Okay.
In most cases, it will be said, Section 22A. It's not. It does not include that. So, meaning you can continue and provide those services without a license from Department of Health, because the expectation is that you are not giving the medication you are giving. They are more in the supplementary. It's supplements.
As in, it's homeopathic.
Yeah, homeopathic.
Makes sense.
Good. So, but I always, and I'm gonna say it to you, and I'm happy you've got Section 20. I always encourage people to have Section 22A. As long as you are given medication, anyone can react to anything.
That is so true.
Someone can come to you intoxicated. You don't know them. They don't tell the truth when you do assessment, and they react and they end up in IC. You understand? So, Mina, I always encourage people to have proper documentation, the right information, and to have those licenses on their walls to govern them, to practice say in a safe environment. You understand?
Also, that would be a great idea to go to to a bar where you know that they have certifications on the wall.
On the wall.
Yeah. I'm just gonna aggressively come on this to the viewers at home. Please, it's your responsibility. You are allowed to ask someone about their credentials. You are allowed to ask if they are qualified for this. This is your life. Take care of yourself. Don't just go and give them your hand for them to look for a vein. They are not trained to search for a vein. The next thing, they are in the tissue, they're in the muscle, they're in the wrong place.
And it's not even like they're cheaper than the ones who are regulated.
You get what I'm saying?
It's money making.
It's money making more than health.
Health, because we come to you in the aspect of wanting to hydrate you, to give you the drip that will benefit your life. More than anything, we see is the treatment. But yes, unfortunately, there are other centers where they have to have 10 patients per day regardless. You understand?
Yes.
Yeah. All right. Guys, just to at home, please come to NBS. Nest Business Solutions is a way to be. If guys, you are still like doubting us,
It has
it
been tested, tried, and proven. Come on.
this is the journal, guys, that you need most to encourage you, to empower you guys, to actually give you education that you need, to expose. We are having our respectful special guest that comes here every week to come and tell us about more opportunities, the collaboration. You know, there's one quote that Dr. Tracy de Klerk mentioned here on this chair, and I don't forget that. She said, if you want to go fast, go alone, but if you want to go far, take people with.
That's true.
That is true.
Yeah.
But also,
Very
Austin, you've been to the summit, you've been to the opening of the other clinic.
Yes.
What are you seeing with NBS doing?
I'm seeing a big,
He's a
very
member,
big
apparently.
movement.
Currently, you don't know the members. Are there many of them? Everyone is joining now.
No, no, with him, he talked about it,
Yeah.
and he has he's got a structure. He's got a full structured
Yes, yes.
company. I think for him to be part of NBS, He wants that facelift,
Yes.
Wants that facelift. He wants to inject.
Actually, let's give it to him. If somebody has a clinic and wants to join Vele NBS, what
Yeah.
would be the reason
Re-
according to you?
You know what they say? They always say that if, as Sister Maureen has said, that if, how do I put this? Even if you're doing something, if you do it with other people, it becomes broader. You can still be yourself cooking KFC in the back room of your house, and then you cooking better chicken than KFC, but it will end up in the back room of your house. Am I wrong?
That is so
If you've got the brand KFC, KFC will take you far, and then you'll be like, no, okay,
yeah.
I'm partnering with Sister Maureen. We are selling KFC. That is basically going big with your company
Wow.
as well.
Makes sense.
So that is the broadest aspect of the business. That the reason why I joined NBS was because I wanna support Sister Maureen. I wanna support my company as well to be broad and
Yeah.
to take it far as much as she's taken her brand very, very far.
True.
So an island on my own, I'm just gonna serve my own kitchen.
Gonna be in the
Am I
same
wrong?
position.
When you partner with bigger companies, you also become bigger because it shows you that you see the picture.
Yeah.
You go in there. It's sort of like I'm not gonna say okay. The person that I look up to is the person who's doing barking the something in my house. I don't want to name. So, but if I say no, I'm partnering with Oprah. People can even see, oh, this person sees a bigger picture with themselves, or
But
they want to
also,
go big.
Sister Maureen, wait, what do we then offer as NBS to people who already have their clinics?
We offer publicity. Yes. What he's saying, if you want to go fast, go alone. If you want to go far, go with people. His growth is my growth.
Yes.
Understand?
Beautiful,
So we still
beautiful.
people are sitting with businesses that are not productive, that are
not
making
doing
money,
anything.
that are not financially sustainable. You understand? And they are sitting. That's where the demoralization is coming, where people feel so it's not working, Mara. I've done this. So that's where MBS is coming. We are waking you up. Hey, Zoga.
Let's go.
Time. Let's go. Let's do it together.
Yeah.
Let's hold your head. We sit down with you. We've got our one-on-one sessions. And then we sit down with you and we listen to you. We understand you've got a full structured
Yes.
entity or organizational program. What we come as is to see what can we spice, what can we use to spice
Campaigns.
up.
Yes.
Campaigns.
I wanted to get to that part. Yes.
Awarenesses, campaign, outreaches, events like that.
Look on us, Sister-
Publicity, marketing.
Look on us, Sister Maureen. Sometimes you know when you're doing something by yourself, and you keep on mixing the coffee, and you're like, okay, I think coffee is fine with 4 spoons. Can't it's wrong, but for now you're still doing good.
Yeah.
The moment you partner with other people or NBS,
Yes.
they know no, you add 2 spoons only. It's fine. You'll acquire the taste with the long run, and then you realize, oh, okay, I was doing this wrong. Actually,
Yes.
somebody bigger who has went through that is correcting me. Because at the end of the day, I'm gonna get into places, and then I'll be like, no, we mixed the coffee with 4 spoons. And then in China, they'll be like, eh? Who taught you that? And then that time at home, they didn't correct you.
Yeah.
You're already in China, and then you're going to mess up a brand in China. You get what I'm saying? So it's better to partner with NBS, and then they'll be like, no, before you go to China, correct this. This is how we make tea. This is how we make coffee. And
There's
then,
also been this uplifting of skills
yes.
with NBS.
Training.
True, right.
Really. There's this partnership with many other companies.
FPD.
Thank you.
Foundation for Professional Development.
Development.
So what we want you to, what we want to see you doing in your own space is that confident, as that knowledge, as that certificate that is from FPD, sa wound care,
Yeah.
that you know what you are doing.
Yes.
A re nyake o dire dilo ka morago ga mabaka,
You know.
you know. Yeah.
Make sure that it's up to the T.
So that is the benefit you will get
Of partnering.
of partnering with
Wow.
NBS. NES Business Solutions, guys.
We've never spoken about that. It's so nice that we trust.
Yeah.
We always talk about nurses, but now people
And
they have them
business.
already. Now they know.
Yeah, we've got a lot of people who are in the business, but they are not doing well. They do
Yes.
approach us
Oh.
and they want us. And again, the important part is that, like I always say, I had to knock onto a lot of doors.
Yes.
I got to the medical aid space. I know that in some of the biggest medical aids, they are in need. They want to partner with RNs, registered nurses, or the clinics like H2Os. You understand? I saw. I see here he's doing IV, antenatal, and I saw antenatal and postnatal. Ne?
For
Yeah,
babies.
for babies, and he's also doing IVs.
Mm.
Have you thought of partnering with entities like Discovery? But they've got a program called Discovery Home Based, where they are looking for nurses and obviously PNPs that they can partner, and they work with you. Have you thought of that?
Yeah, I think I've considered it. That's why I'm saying whenever you partner with other people and other companies, it brings you a bigger space. Because I think I got the idea from Sister Maureen. She was like,
Wow.
no, there's this and this and this and this and this. And I was like,
And they
oh,
were at the
okay.
event as well.
Yes.
They were at the
Oh, wow.
event as
And
well.
she's the one who advised me, or no,
See,
you can do this with Discovery and do it 1, 2, 3, 4, 5.
Beautiful.
Put IVs and at home, and then this is what you
Back
do.
to your
Yeah.
question, ya gore, why is it important for
So
for even those
if you
that have
already
attractive-
have.
Yeah, it's because
Yeah.
Sister Maureen, or let me just say NBS, will open more doors for you.
Exactly.
Understand?
Because of
We
the
will
people that
expose you, yeah. And then it's like, I'm gonna mention my company proudly so. Proudly so, because I've signed SLEs.
yeah.
You know, signed
Yes.
service
Yes,
level
yes,
agreement with
yes,
these guys. So I mean, yesterday I got a video from Sister Anna Milorani in Polokwane. She had a coloplast. They traveled all the way from, shout out to coloplast guys.
Wow.
They traveled all the way from Johannesburg to Polokwane to go and practice, give Sister Anna practical training on their products,
Oh, nice.
on the coloplast.
That's beautiful.
Then now that is an additional service that she's adding in her practice.
Oh,
That
that's beautiful.
each and every doctor, everyone in Limpopo, Polokwane, the surrounding areas, if you've got a coloplast, you've got colostomy bag, you don't know where to change it, please go to Sister Anna. We're gonna put her details on this video.
Beautiful.
Go and consult with her. She is trained, she is skilled, she's a registered nurse, she knows what to do, and she has partnered with a lot of hospitals. And we are partnering with her next week, Saturday.
Oh, yeah.
Be in Polokwane in the Royal Hotel. Guys, if you haven't bought your ticket, we have until Thursday night
Yeah.
Yeah.
for ticket purchase.
Yes.
So please run to the CompuTicket. Just type there NBS Kickstart Polokwane, and that will come through. You will see Sister Maureen's face, and you go and buy the ticket. We are bringing people with information. We are bringing companies that we have partnered with. We are bringing companies that will actually benefit your practices if you've got a structure already. If you don't have a company, believe me, be ready, because on that day you are going home being a CEO. Yes.
Yes.
Guys, the good thing is today we are going to go home being hydrated, and we are going to test. You know, today I'm a nurse. I'm going to test my mannequin,
Yeah.
feel the taste, mannequin, the taste of my own medicine.
Own medicine.
Yes. The nearness is definitely.
Yeah.
Practically,
I'm
literally.
used to inject. I'm used to infuse, to give drips to patients.
Yeah.
Today I'm not a patient. I'm a client.
Okay. Okay.
Because this is now in the cosmetic space.
Yes.
So we are going to have Austin. Let's say professionally, we are having the clinic in the house, H2O in the aesthetic space.
Beautiful.
Today we are getting drips, and then I am going with the jet fuel.
Yeah.
And what are
I'm
you
going with the detox, right?
detox?
Yeah.
Yeah. And
You
then
said you're gonna mix it up for me, right?
yeah.
You still thinking libido there?
I don't like libido.
I don't need it.
I don't mind it.
Okay.
Guys, why? Let's talk about it before we go there. Why people always feel shy when we talk about libido? Libido is a medical term. It's a drip that is needed. It's a medication.
I'm not shy, then.
not cut-
I'm not shy, guys. I don't do this.
You know, sister. Yeah. Thank you for that, Sister Maureen. You know, most men find it derogatory to say your libido is low. They thinking about all those sexual things, erectile dysfunction and all of that, and it's not.
So what does it mean?
It's all about boosting your sexual hormones. Not that you've got erectile dysfunction, and all of those. No. It has nothing to do with that.
So now we
It's
can-
all about.
No, give me the detox. I don't need the libido.
And whenever you get the libido drip, with libido, it boosts also your confidence.
Okay.
It gives you that.
I think what we must do is to actually describe the benefits of libido as a whole.
Like that, it just boosts your sexual hormones.
Okay.
Not about erection or anything.
Yeah.
It just boosts your sexual hormones. It's like saying what? It's like saying libido drip is more like your
Energy.
energy drip.
Because you know
Oh,
what?
true.
Energy. We get exhausted.
I feel
We
you.
get taken
Stress.
away, carried out by miracle, stress, and miracle, like the way
And that
we
affects your libido.
financial problem. That actually affects your hormones. You understand? So why not get a boost as much as one no kinyaka jet fuel, kinyaka vitamin D, whatever vitamins are.
Hey, that's
Nah, I think I'm changing my mind. People don't call libido more.
the
Pillows. Someone, what are you looking? What are you looking at? All right, okay, guys. Yeah, it's a lovely show today. I love it. We're gonna continue with our episode, but then differently. We are going to have lines attached to our veins. That's beautiful. So yeah,
Let's prepare.
thank you.